It was chronic pain. It started with my back. I couldn't bend, and it was really hurting me. For many years, I've been going to a chiropractor maybe once a month, but this wasn't going away. So I finally went to my physician. She suggested that I go to therapy. Well, the therapy was the same thing. It would last for a day, and then I'm back popping pills. So then I decided, well, maybe I'll go for some pain shots. And the pain shots were okay for a while. And my doctor suggested that I go see Dr. Richards.
Mr. K came to see me earlier in the year, and he was having severe back pain and lower extremity pain. It was really getting to a point where he was debilitated by it. He wasn't able to do a lot of the things that he enjoys doing because of this pain was interfering with his life so much. When we got an MRI of his low back, it did show evidence of a synovial cyst that was causing a lot of compression on the nerve roots in the low back. It also showed there was some evidence of some instability in his back. And because of that, I felt like he needed a lumbar laminectomy infusion. He had really exhausted all the conservative treatments that we could offer him. And so therefore we decided that we needed to proceed with surgery. However, during the consultation I had with him during my exam, I noticed that his reflexes were quite brisk and had symptoms and signs of spinal stenosis and spinal cord compression in the neck. Therefore, we obtained an MRI of his cervical spine and found that he had severe stenosis in his neck as well. I felt like this was really causing a problem with his balance and his hand coordination. Therefore, we decided to treat the neck first, actually.
So I went and had the surgery done.
We did what's called an anterior cervical discectomy infusion, where I took out 2 discs and replaced them with little spacers and with screws and a plate. He did quite well after that surgery, and then we proceeded to fix his low back a few weeks later.
Each time I was up and walking. I mean, I was in the hospital the one day for the neck, and I went home the next day. I didn't even have to stay overnight, but my wife suggested that I stay overnight, and that's what I did. And then 2 weeks later, when I went in for the other surgery, I was up the next day. I was pain-free from the time I had the surgery. Didn't even know, that I even had surgery. I just felt great.
At this point, he's approximately 3 to 4 months out of surgery, and he seems to be doing quite well. His pain is essentially completely resolved. He's gotten a lot of his coordination back in his hands, and his mobility has definitely improved.
I feel great. I'm back to exercising. I'm on the treadmill. I'm even doing sit-ups. I can't wait to go back golfing. I'm not restricted to anything. And if anything, I'd suggest anybody going, if they got problems, see Dr. Richards.